I'm excited about our next guest, Dr. David Schwegman. I love that name, and he actually has been my doctor. I have used hyperbaric therapy, and I'm excited to have you on the show. Welcome.
Thank you so much for having me. Appreciate it, Dr. Gals.
You're the Chief Medical Officer of Hyperbaric Physicians of Georgia, and I love what you do. I have used it. You've been my doctor, and this is innovative care, and it's been around for quite a while. So tell us about what is hyperbaric therapy and its history.
Sure. Hyperbaric oxygen therapy is really simple. It's basically taking a patient, putting them into a sealed vessel, and using compressed oxygen to create physiologic effects in the body that create healing.
Right, you're driving oxygen in.
Exactly.
And oxygen heals.
It does indeed. Power. Oxygen is actually a necessary item for wound healing. You don't have it, you don't heal.
And as a head and neck surgeon, we have had the need for hyperbaric therapy. We operate on people who have cancer that have undergone radiation to treat that cancer. And hyperbaric therapy can really help these people. Tell us more about that.
It really can. People that have had radiation therapy for cancer, half of folks who have been treated with cancer that are long-term survivors have had radiation therapy.
Yes.
And although radiation is really, really good at killing cancer cells, it's also really good at killing the blood vessels that supply those organs that are in the pathway that the radiation goes through. And so folks that have had radiation treatment oftentimes have damaged organs and damaged tissues in that path. And as time goes by, those tissues tend to start to break down because they don't have the ability to regenerate and to heal themselves. And what hyperbaric oxygen therapy can do is actually help to restore those tissues, both by providing oxygen while you're in the chamber, but also more importantly, to help regrow the blood vessels that have been damaged by the radiation.
Well, that's great to hear. So it means that you can go through a series of treatments and have benefit. It's not that you have to keep coming back over and over for
That's
therapy.
Actually what's great about hyperbaric oxygen therapy is not only is it a definitive therapy while you're there, but it's not like you're going to the gym for 6 weeks and you start building muscle in your arms and you start to like what you look like in the mirror, and then after you quit, it goes away. The effects of hyperbaric oxygen therapy are actually lasting. So by you creating this brand new set of blood vessels, they're there 10 years from now. You do a biopsy 20 years from now. They're fresh, brand new, viable blood vessels that not only help you heal while you're there, but have permanent and lasting effect.
I'm thinking as we're talking, first, I want people to know why I went. I'm not only the president, I am a client. I do nasal surgery, and I had my septum straightened, and I can breathe now, and my sinuses open. And I know enough about hyperbaric to know, hey, that would help me heal. So, fortunately, there are advantages to being a physician. So I sought you out, and actually we've known each other for years, come to find out. And I hopped in there, and I'm telling you, I healed up in no time flat. But I didn't have to have it. But there is one condition that is permeating society, and that is, diabetes and legs, and people having potentially amputations because of it. Hyperbaric therapy, wow, it's the key to saving a leg, and that's important.
I totally agree. I mean, one of the reasons that I am a hyperbaric physician now, my background is actually emergency medicine, but to relate a personal story, my dad was a type 1 diabetic, and he had ulcers on his feet. And basically for 7 years, he continued to have surgery after surgery and IV antibiotics, and was hobbled and sick and unable to work and unable to have any quality of life. And he eventually died because of it. And he never had hyperbaric oxygen therapy. And I didn't really know anything about it. And I kick myself every day now. And it's a personal crusade for me for my dad and for everyone who has a dad or anyone who knows someone with diabetes and an ulcer on their foot, is that amputations are preventable, and with the right care, you can save legs.
Yeah, and that's important because this show is about healthcare consumerism and economics of healthcare as well. And to save a leg has a big financial benefit.
Of course.
To society and to the people and the providers of healthcare.
Absolutely. I mean, once you've lost your leg, how many people can maintain their work status?
That's
Very
right.
few people can work without limbs. And the drain on society of these folks, and their lost revenue, the lost time, and also the loss of their life, their livelihood.
Right.
Their joie de vivre, the reason of living.
It's even though they're great people that make artificial limbs, it's still not the same for people. It's a major, well, and it's great that we have this, no doubt, because it is going to save money for people if they know about it. And this technology has been around for years.
It has. It's been around actually for hundreds of years.
That is incredible. You know, out of Birmingham, there was a hospital that basically that's all they did for a while. Once again, I want everybody to know that about you, Dr. David Schwegman, who is medical director of the Hyperbaric Physicians of Georgia, on the show. A good thing to come out of this, and we hear about it, talked about like college athletic programs use hyperbaric therapy, right? Some of them have hyperbaric chambers.
Sure. And in fact, there are a lot of professional athletes that have hyperbaric chambers and own them.
I know a family here in town, pretty well known. They're one of their sons is playing real football, I'll call it, at a college. And he will actually go in there every day, you know, and it helps him heal up from the hits and bruises that they've sustained. So this technology is being used by people. Just improve the quality of life.
Absolutely. Our goal at Hyperbaric Physicians of Georgia is to use the modality appropriately and when it's indicated. When people take it into their own hands, I'm not sure I agree with that 100%, but obviously we'd be happy to help guide folks with that. But in particular, it
is interesting, though, that people are hopping in these chambers at their home, but it's not like what you do. Obviously.
Well, there is a use for that, particularly for folks that are professional athletes that have had traumatic brain injury. I mean, you see so many folks have concussions all the time, and we've successfully treated professional athletes and professional football players with traumatic brain injury.
Really?
Absolutely.
That's a great use, because that is way in the news now. All these kids playing, football or whatever sport and having traumatic head injuries. So would somebody after a concussion need hyperbaric therapy?
Not necessarily after just a single concussion, but for anyone who has seen a physician related to concussions or multiple concussions, or have had any sort of neurologic deficits or any mental problems related to having head injuries in the past, it's definitely something that we can help with.
Well, what are the indications? How would someone get to you for therapy?
Well, I would say that for most mainstream indications for us, there's three classes of folks that we see. So it's people who have had cancer with radiation treatment that are suffering effects. So breast cancer patients, and I noticed actually both of us are wearing pink shirts.
Yes, we are. I'm so glad you brought that up, Vicky.
Mine is for obviously for Breast Cancer Awareness Month.
It is. That's what it's about.
For gentlemen who've had prostate cancer or women who've had breast cancer, if you've had long-term effects in those tissues, so folks that have had bleeding in their bladder, blood when they use the restroom, for women who've had breast pain that continues after surgery, or have wounds that won't heal up from their surgeries. Those are folks that we can help. Diabetic patients, so people that have had diabetes or peripheral vascular disease. And I would say that those are the three big groups of patients that really would benefit by giving us a call. The way to reach us is really, really simply, our website is www.hbomdga. HBO is hyperbaric oxygen, MD for physicians, GA for Georgia.com.
Not the cable channel.
No.
Okay. That's good. That's great. So they can go. Tell me, in this last couple of minutes here, wanted to, since you're a physician, you're a patient advocate, and this show is about the changing healthcare environment, the law. How is the Affordable Care Act affecting your ability to treat patients?
Right now, actually, it's been a negative for us. We've actually had a number of patients that have Affordable Care Act policies and have come to find out that after we've treated them that we're actually not considered providers for them, that the Affordable Health Care Act, they haven't decided who is going to be hyperbaric providers yet. And so...
Well, is there one in Atlanta?
I don't think they've actually chosen the providers yet. So all of us are on hold. I mean, it doesn't change who we are. We don't treat patients based on income or money, but for
think
us,
about
it's been a negative.
If you're on an Obamacare plan, you're going to be out of pocket $6,350, period, to begin with.
Well, I think clearly what happened yesterday with Walmart, the fact that they're cutting 30,000 employees' healthcare benefits is a sign. The fact that they couldn't afford that is a sign that, unfortunately, I think the intention was probably good with the Affordable Care Act, that I'm hoping they thought it was going to reduce costs, but the idea that paying for hospitals, medications, and everything that goes along with that, and then adding a government bureaucracy to weigh it down on top of that would be more affordable. the whole concept has never really made sense to me, and I think that that's actually what's playing out at this point.
At this point, there are a lot of things about it that I like, no doubt. Not having a pre-existing condition, being able to stay on your parents' insurance, wellness exams and whatnot. But what we're seeing and you're experiencing, and listen, we're the low-cost provider of ENT care. No one can do it for what we can at the ENT Institute, and we're not on one Obamacare plan. And why? Because they want to limit the access to physicians currently. That's what they're doing. That's why you're not on the plan. That's why we, as the low-cost provider, are not on the plan. And this is a story that will be told in the future. And this year is going to be a wake-up call. So we're going to learn more about it.
Oh, absolutely. I mean, when you take a patient and you make them pay more and more money for health care, they're going to choose to not go. And ultimately, that is a cost savings to the government.
There's no doubt, whether it's government or the insurance companies, too. But, it's a story. It's a story. We'll see what it's about. And that's why we're here on Doc Talk talking about it. Listen, thanks for joining me today, Dr. Schwegman.
Gallups, thank you so much for having me.
Once again, we've been talking to Dr. David Schwegman, Chief Medical Officer of Hyperbaric Physicians of Georgia. You're listening to Doc Talk with Dr. Jeffrey Gallups on Talk Radio 640 WGST.